This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
Good evening, everybody. Happy Sunday evening. We see a lot of back pain patients in the emergency department. Usually it's just a matter of trying to get them feeling better. There's lots of different things we can do. And, we've been doing, more trigger point injections over the last couple of years, which is where you inject bupivacaine into the area that hurts. And, sometimes it can be very effective. There was an interesting trial I saw recently on something I'd never heard of before. A similar idea, but it's called Intradermal Sterile Water Injection, where it's a technique, what it sounds like, intradermal, so fairly superficial, almost like when you get a TB test, and it's sterile water and very small amounts. 4 injections in a little square of 0.1 cc's in each little square. So a tiny little wheel in a square kind of around the area of the pain. It seems, how could that possibly work? But it's been shown in other kind of non-emergency settings to help with, musculoskeletal pain. So the study was, fairly good study, randomized, a couple hundred patients with acute back pain to either, this is another country that used an IV NSAID similar to Toradol. I forget which one I'd never heard of. Actually, both groups got the IV NSAID and one group got these injections. And the differences were pretty impressive. They looked at it like 10 minutes, 30 minutes, 24 hours. They looked at satisfaction and they looked at the amount of opioids, and everything was dramatically better in the intradermal sterile water injection. Like at 24 hours, the reduction of pain was like 7 points in the procedure and 2 points in just the NSAIDs. Like only 12% of people who got the injections needed opioids, whereas 50% of the people that didn't get the injections needed opioids. The satisfaction was like 87% compared to 16%. So like really impressive results from a total of 0.4 milliliters of sterile water being injected. So some of this possibly could be some just placebo effect, and placebo effect can be very powerful. There's some pain pathway reasoning for it. So I've kind of been waiting for the right patient. If I were going to do a trigger point, I'm going to say maybe I'll try this intradermal sterile water injection. So obviously I think it's very safe, and if we sell it, maybe it works great. So any questions? Anyone heard of this before for any other pain modalities? No. Thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.